Doc. How are you?
Appreciate you joining us. Well, good morning, all our friends along the Gulf Coast. We are so glad you joined us here again today for another episode of the Echo Stop Live podcast. I'm here with my good friend, Curtis.
Good morning, Kevin. How are you?
How are you, Kurt?
I'm great, man. It's Friday. What else could it be other than just great, right?
Well, it is great. I got a surprise for you.
What's the surprise?
I'm sure you're not aware, but we have a guest joining us today in the studio.
Let me make sure I have the right glasses on. Looks like Dr. Michaels over
It does. Well, listen, Dr. Michaels, we appreciate you joining us today on our podcast, and maybe we'll just spend a few minutes, have a conversation, and just talk a little bit about what you do and some of the things that are great that are happening in our community that maybe some of our viewers don't know about. All right, so we're going to do that, right? We're in for that.
Hey, we're going to go for it, man.
Questions.
Lots of questions.
Nothing like having questions you don't know what the questions are.
Well, we have a game that goes just like that, but we're not there yet.
No.
But so tell us a little bit about who you are, what you do, and your job here in the city.
I've been appointed to the health officer for about a little over a year now. And as a health officer, I'm responsible for the public health or the health of the community for strictly Mobile County from that standpoint. So I've been a physician now for about 30 plus years. Originally went to school here at Mobile, graduated from the medical school, entered the military, and my wife and I talked about when I retire, maybe come back to Mobile, and that's how things worked out for us.
Well, that's awesome.
So we wanted to come back here.
So that's a double service on a service, right? So you went into the service of health and keeping people safe through health, and then you did that in the military. So you did a service on a service. That's pretty impressive. It's a double service on a service. That's what we're going with today.
And then continued on after we retired. So.
Yes, sir, and came here to work in the county. We'll kind of just share with our viewers. So, we have these conversations about public health. We've had guests on the show. We've talked about mental health. We've talked about physical health and stuff. But really, we want to talk about not only things that are leading causes of death here in America, but also how violence plays into a lot of that and how there's an impact associated with all things, and things are kind of interrelated. And obviously, that would be your expertise, and that's where I'll get quiet and let you do a little bit of talking. But
I think part of it is we're talking about violence,
right?
And typically depends on your perspective where you are in your life. If you're older, 50 and above, you probably think that heart disease and cancer are the leading causes of death. Maybe in that population. But when we get concerned in the community when you start looking at the 15 to 30-year-olds, the biggest thing we're seeing now is violence. And violence is all collective, whether it be firearms, fighting, all those things kind of wrap up. And so that's the impact at that age range where you start losing life years. That young 15-year-old that loses their life, they have a whole life ahead of them.
And this is the great thing about the public health department, the Mobile County Health Department, because you guys not only do public health, but you also educate around public health, making sure people understand what that means, because a lot of times we don't educate people on the things that we want them to be more thoughtful of, and you guys do that.
Yeah, we have a number of outreach programs that we're engaged in, and they're school-based. They're community-based as we kind of get into the church groups. So we're trying to cover the whole gamut in showing positive lifestyle or behaviors in the community, because violence. People will talk about violence as a cycle of violence. So if you're exposed to it as a young person, you may accept that as the norm and think that that's what we're supposed to do in the community, and we want to prevent that.
Right. I gotta backtrack for just a second. I'm sorry. I like to get into the details sometimes and ask some good questions, because not only is our job to share this information with our viewers, but we want to be as educated as we can so we can have good conversations with great people like yourself. But I got to go back and say this. If you hurt yourself, well, I don't know, I'm just thinking of something. Like you have a back injury, right? Let's say you hurt yourself. You're laughing like I'm going
No,
or
it's
something.
an inside joke.
But let's just say you hurt your back. I mean, it's obvious that at some point you may have to visit a doctor.
Absolutely.
And you're going to go see a doctor because you know that there's a person who's a professional who has the experience, the knowledge, the training, the skills, and the ability to even prescribe, to do whatever, a procedure, medicine, whatever it is, to get you back well in your health so you can perform at the optimal level. Okay. But we look at violence, and that might have been a word for you too, by the way.
I'm
but
tracking you. Go ahead. Go ahead. Yeah.
We look at violence in our community, and we try to take it on ourselves sometimes. As well, how are we going to solve this problem? And we may or may not have all the knowledge, the skills, and the abilities, or the resources, or the capability, or even the legal authority to do some of the things that are needed to prescribe, if you will, what might be required. Now we all have a stake in that, but you couple that with what we're seeing when you talk about the age. So hold that thought for a minute, and then bring in this other sort of thought on the side where we're talking about youth. I know from my own experiences, seeing sort of a decline in the age, right? So what used to be 19 to 24-year-olds now becomes 15 to 17-year-olds. And so there's sort of this thing going on. At the same time, here along the Gulf Coast and in the city of Mobile, we know we're making dramatic improvements. And there's this perception issue where how do we share the information? Part of the reason we have the podcast, so people can come into our world for just a minute and see what's going on. Both of y'all, if you don't mind, give me your opinions on what do we do so that people react to the ailment of violence in the community the same way they would if they hurt their back?
I'm going to say this and hope Dr. Michaels can fill in the rest of it for me. I think that going back to the importance of educating people on the things that they need to know. We talk about trauma, but we also talk about now educating people on what trauma looks like, because oftentimes people don't equate trauma to be anything other than a traffic accident or someone injured from a traffic accident or some other physical accident. They don't think about the mental aspects of trauma and how their vicarious trauma also plays a role in how people actually process traumas. I think that when we fail to educate people on what trauma looks like, or we fail to educate people on what they need to know so that they can prevent future reoccurrences of things, I think we fail or we miss the opportunity to truly impact in reducing violence.
So there's a cost with violence.
There is, and there's no reset button. When you make that decision to take somebody's life, I mean, I'm not talking right or wrong, but when you make that decision, there's no reset button to go, wait a sec, I didn't mean to do that. We have a loss of life, and however it occurred and what violence, the situation there, and so there is that what society has created, and not necessarily acceptance, but society has created, with the Xbox games and those leading on, watching how parents engage, and there may have been violence in that household, and as that person grows up, they don't see what normal, what normal should be, or they hear gunshots in the community. Is that normal? Is that accepted? And it's not. And so we have to reset and educate them.
Wow, it's almost like the heat of the moment drowns out the coolness of a lifetime, right? And so we see that split-second decision, but we don't look at the many, many, many split-second decisions that happen over someone's lifetime. And we focus on this one, and then when that second's gone, we're like, now we deal with the consequences. Like now, where do you go from here? And so this is part of the whole rebuilding the mindset of the focus to where simple things like resolving conflicts, skill sets that a lot of people may or may not have ever been taught or have had very bad influences or no influence. How do we reset that mindset so that we're instructing people, hey, we don't all have to agree, but there's ways that we can resolve conflicts without actually causing violence to one another.
Well, it all goes back to education again. I mean, when you go to the doctor for a problem, your doctor's going to educate you on what the issue is. Well, you're perfect.
I'm speaking that into existence.
but your doctor is going to educate you on what your injury is, and he's going to also, or she's going to also explain to you the things that they're going to do to help you mitigate the pain, along with the things that you need not to do to inflame that situation anymore.
Well, and along these lines, we're asking our viewers to come alongside us, and we have several different ways that you can do that. We have an email that we would encourage you to send us your comments, questions, if you want to contribute, if you think you've got something of value. We know you have something of value, and we'll ask that you send that to echostoplive@gmail.com. That is echostoplive@gmail.com. And if you hear something, know something, or want to say something, as we say, see something, say something, and do something here, we also have an anonymous tip line, and that is 844-251-0644, 844-251-0644. That's our phone number. You can send us an anonymous tip. You can text us something to that. There's QR codes on signs all throughout the city and other partnered places around the Gulf Coast. So we would encourage you to participate in that way. But before we get back to this conversation, Curtis, I think now is a great time to really take a look at what the Mobile County Health Department's doing for those that are interested in knowing just a little bit more.
Hi, I'm Brittany Stuber, Clinic Administrator with Mobile County Health Department and our Family Health Clinics. I'm here today to introduce you to our Mobile Medical Unit. It's a brand new unit, as well as our team. We'll do a tour. It'll be a lot of fun. Come on.
Hola, ¿cómo están, amigos? Yo soy Celia Adams de Mobile County Health Department. Yo soy un bilingual clinic clerk y puedo ayudarles a hacer citas o ayudarlos en registrarse, lo que necesiten. Aquí estamos para servirles. Gracias.
Good morning. My name is Alicia Simmons. I am the driver of this brand new, beautiful mobile unit for the Mobile County Health Department. And you are more than welcome to come out and see the unit when we are out in our community reach.
I'm Charity Gardner. I'm the Health Services Administrator for the Mobile County Health Department, and this is my bus, and this is my team that you're meeting today. We also have a nurse practitioner. Her name is Jolanda Amy, and we have just recently hired a new medical assistant, and that makes up our team that runs the mobile unit.
To schedule an opportunity for the unit to come to your community, special event, or workplace, reach out to Mark Bryant at mbryant@mchd.org. That's MBRYANT@mchd.org. Thanks. First, I'd like to show you our laboratory. It's a full diagnostic laboratory with all of the capabilities that we have at our stationary health centers. Here, we can draw blood and perform labs, including HbA1c, blood sugar testing. You can also get tested for COVID-19, strep, or the flu, and a variety of other diagnostic tests. Hi, so next we have our clinic check-in area and our patient waiting area where you'll get ready for your appointment, check in with our clinic clerk, and any people that are accompanying a patient can sit and wait in comfort. Patients can expect the same level of care and comfort that they would receive at our other health centers located throughout Mobile County. The room also features a wheelchair lift to assist individuals with mobility challenges.
The unit is fully equipped for physicals, routine visits, as well as sick visits for both adults and children.
Pero espera, aún hay más.
There is more.
That's right, we have dental, so come see us for all of your healthcare needs. Follow me to better health.
Síguenos hacia una mejor salud.
We'll see you on the bus.
Well, Curtis, I was watching that, and Doctor, it's amazing what is happening and changing sort of in the wheelhouse, if you will, of medicine and how it's more accessible.
Right.
And we were just talking during the break about, and you were talking about how it's mobile and how it comes to the community, and I'm thinking back to even last year's community days where we were bringing things out. So let's talk for a minute about the importance of making things accessible. So you have this great tool, but if people can't get to it, how does it help them, right? So let's talk about that for a minute.
Well, I think Dr. Michaels is probably better suited to talk about that, but I will say that community days, you've been out to the community day events, so you understand the importance of bringing resources to the community for the community, because oftentimes we're dealing with people who need services but don't have access because they don't have transportation.
Exactly. Just to clarify, Mobile County Health Department is really divided into two parts. We have Family Health, which is a federally qualified health center, and we have clinics throughout the community in Sims, Mount Vernon, here within Mobile, 8 Mile. So we're spread out. And we also recognize that there are certain areas where people are limited by transportation access, that we can go out and take our mobile medical unit and provide services there to them. Again, it doesn't have X-ray capability. They're still going to have to come back to a brick and mortar facility, but at least gets it out there to address their personal health issues. All right, and so when the community days, we get that mobile medical unit out there, but we also bring other activities, working against opioid or substance use, health equities. We also have programs out there to address, vector control. People don't like getting bit by mosquitoes. We're moving into that mosquito season. So we have all these programs out there to reduce their risk. And one of the significant part of what we provide is that health, that primary care to the people of Mobile County.
So let's talk about prevention for just a minute. Violence is preventable too.
Yes, it is.
Ideas on prevention of violence, things that can partner between agencies in the health department and students, people that come into the facilities. What are some of the things that you're thinking?
I mean, back during the 1960s, the Surgeon General of the United States identified that violence was an issue for our community or for our nation, and we spent a lot of time researching what are the risks of a person to be involved in some type of violence. And we came out with risk indicators or behaviors that put people at risk. And so we have a number of targeting, number of programs, the fatherhood program, which helps people re-engage, set this is a positive role model and help them. They may not have gotten it when they were growing up, but now they're going to learn those skills to be a positive role model. So there's the fatherhood program, and then we have at University Hospital, we have a level 1 trauma center. And so the trauma surgeons are out there engaging in the community to take youth and show them what potentially, making good choices, you can end up doing these positive things. And if you make bad choices, kind of, not necessarily scare them, but show, the poor decisions that occur. So there, it's not just what the health department's doing, it's what the whole community's doing.
Yeah. And so I think one of the things people don't know in our city that we have to do a better job in trying to make sure we get the word out, and that is that we are intentional in trying to build a collective impact approach to addressing violence in our community, working closely with the health department, with the Mobile County Health Department, working closely with University Hospital, working closely with our education system and law enforcement, all working along with nonprofits as well as other agencies that have a vested interest in public safety. So I think we're making great strides at doing that. Always more work to do, but what we have to do more of is try to get the community to actually get involved. And I think the community day events help us with that.
Yeah, yes. And what we're really talking about too, when we talk about public safety, I like to look at that as public resolution. Like we can't say we want public safety without the public coming alongside, finding ways to resolve conflicts, finding ways to agree on what they can agree on, finding ways to collectively move in a better direction. You mentioned the word scare, and you're like, hey, well, we're not scaring the kids, but we're just showing them the realities. And I think sometimes the realities are scary. And certainly we're not in the business of traumatizing anybody, but I think if we don't highlight the fact that this is a one and done option, if you go down the violence path, you can't undo violence. There's other ways when you take a holistic approach, when you take a collective model and you apply all those things, there's other ways. And we have to be the ones to bring the resources. I'm sure you've seen from past episodes, we follow what we consider to be the 4 pillars approach to society. That's faith, family, education, and government. And when you start diminishing or deteriorating each one of those pillars, then the community doesn't really balance out really well. And of course, I see medicine touching so many of those pillars. What are your thoughts on, asking the whys when and I know medicine asks the whys a lot, but in society sometimes we focus on the whats and the wheres. If we really want to get back to a season of asking whys, what are some of the things that you're excited about, as far as whether it's the mobility on the bus or other things around, to be able to have that opportunity to engage with the public that you're charged with protecting as far as health and safety, to ask the whys?
Well, I mean, it's engagement in the community. It's being present. It's being present to them, and asking the questions that may be the difficult things to ask, and people may not want to know the answer or even know that we're asking the question, but it's going out there and engaging the community. We divide the population up into groups. You see high-risk groups, and are we getting the right resources to them? And so one of the things that was occurring in the school system was the mental health days, where the Mobile County Health Department was heavily involved with a bunch of other entities going in and creating activities for the students in the high schools to ask the questions and honestly provide an answer to them from that standpoint. So it's being engaged.
Do you see any parallels, because you were active duty military and working in a hospital? Do you see, from a standpoint of any parallels between public health in our community as opposed to public health on a military installation?
Are there parallels? Yes, there are. I mean, we went through probably 10, 15 years ago looking at resiliency. And so we addressed what are those skills to help a service member be more resilient. They're going to be exposed to certain things in their life that most people aren't going to be exposed to, and it's how to cope with that and continue on that call for service. There's a talk of resiliency in the community and helping people to be more resilient and block that cycle, and recognize that if we don't block it, there's going to be increased mental health issues, and there may also be physical health concerns that are there. And so it's providing those resources and realize, the coping skills, the positive role models in the community. So getting, the police, into, as we talked about before, getting the police involved as positive role models and not a threat. Getting, the positive role models of, people returning back to our community and getting them involved. So that's the hard part of asking why. It's just being there present and and answering their questions, because we don't know what questions they have until we ask, why.
Well, here's the question. So we got a question from the community. So Trey has written in to us here, and he's asking us, and so thank you, Trey, for sending in this question. We appreciate that. What location will the mobile medical unit be at next? The mobile medical unit be at next?
On my schedule.
That's a trick question. Well, I'll tell you, if you don't know the answer to that question, what we can do is, if you let us know, we will email you back that location. How about that?
That we will do.
We try not to ask stumpers, but I try to remain true to the questions that we have in front of us here.
But that is a concern. I mean, the mobile medical unit is out in numerous places throughout the community. Even when Wings of Life moved from downtown Mobile out to the west side off of Newman Road, the mobile medical unit is out there on a reoccurring basis to provide access.
And the wonderful thing about that also that I know is that you can request the mobile.
Yes.
So if you have an event that's happening, you can reach out to the Mobile County Health Department and request that the mobile unit responds to that location.
Well, it's been an honor having you on our show. We try to keep our shows to a limited time frame because we want to get the most valuable information we can out what we have there. Curtis, I'm honored to be sitting here with you because I know you've been working with a lot of the initiatives of the health department for a while, and so through Curtis, I've learned a lot, and you're talking about positive role models, and I accept. If you would like me to be your positive role model, I will do that for you.
But it is too early for jokes.
But we are happy that you had the time to come with us. We'd certainly love to have another conversation with you down the road if your schedule permits.
I appreciate it.
I see this as an ongoing venture. This isn't something that you say, do, and it happens on its own. We have to stay engaged. Clearly, you're engaged. Clearly, you've got the God's gift of service running through your blood because you've made a life out of it.
Thank you.
And so we thank you for that. And we thank our viewers for tuning in. Being part of watching something on a podcast or hearing something is not really enough when you want to come alongside us. We are calling action for people to do things. We say here on the show, and everywhere that we bring Echo Stop, that we're not just impeding violence. Like, that's a big part of it, but we are improving perception, and we need everybody's help to do that. Again, you can email us at echostoplive@gmail.com. That is echostoplive@gmail.com, and we'd love for you to send in. We've got hundreds of tips since last year when we opened this tip line, and I cannot tell you how many of them, the majority, the most highest level that I've seen in a long time are actual substantive tips that we're receiving, and we thank you for that. You're putting the time in, and you're letting us know where we can make the community safer, and we appreciate that. But that number, if you want to call it or text to it, is 844-251-0644, 844-251-0644. And in the minute or so we have left before we sign off, Curtis, I'd like to pass it back to you and get your final thoughts.
Final thoughts are, we are true to trying to improve the situation in Mobile. Like so many other cities in our country, they're plagued with so many different issues, all surrounding violence. It's important to bring resources together to attack that common denominator and to improve public safety, because public safety is something that all of us are vested in.
Well, we thank you for that. That's a deep thought, which is really good. But we appreciate that. And for the good doctor here, you've earned yourself an Echo Stop coin. And
well, thank you.
We hope that you keep that as a reminder that together we can do lots of things. We appreciate you for taking the time. We'll see you next Friday at 8:30 in the morning, as we do every Friday morning at 8:30 for the Echo Stop Live podcast. And we hope you have a safe weekend and time in between. And take care. Remember, we're impeding violence and improving perception, and it takes all of us. We appreciate you. Thank you so much.